So whenever the microorganisms enter our body, they will release toxins, and the immune cells will release cytokines against them. The main cytokines which are concerned with the fever, we call them the pyrogenic cytokines, or interleukin 1, TNF alpha, and interleukin 6. Now, interleukin 6 is very important because it induces CRP, and it will cause the CRP levels to be elevated. And whenever there is an acute infection, acute phase reactants are also increased, and one of them is fibrinogen, which will cause the clumping of RBC, and it will eventually lead to increased erythrocyte sedimentation rate. These are the two main reasons why in most of the fever investigations will get raised ESR and CRP levels. But do remember, ESR levels are not always reliable because once they are increased, they will stay elevated for a long period of time. Whereas CRP levels do fluctuate and correlate with the interleukin 6 levels, and that is why CRP is the best investigation to follow up the patients with fever. And the toxins and the cytokines, they will act at both the peripheral tissue level and also the central nervous system level. These toxins and interleukins will increase the expression of an enzyme called cyclooxygenase 2, and it will lead to increased production of prostaglandin E2. The same happens in the CNS also. Now, this prostaglandin E2 is very important in the pathogenesis of fever. In peripheral tissue, this increased prostaglandin levels will cause myalgias and arthralgias, which are very non-specific symptoms and are almost present in most of the cases with fever. In the central nervous system, this prostaglandin E2 will go to the hypothalamus, and its receptor is EP3, which will lead to increased cyclic AMP levels in the hypothalamus. As a result of this, the thermostat, which is supposed to be at 37 degrees Celsius, will now rise to a new level of 39 degrees Celsius. That's around 1 or 2 degrees Fahrenheit. So these are the most important, the prostaglandin E2 and its receptor EP3. So as we have discussed earlier here, if there is fall in temperature below the thermostat level, there will be vasoconstriction and shivering to increase the temperature. So in fevers, we usually have temperatures at around 100 to 101 degrees Fahrenheit. But this temperature, due to the new thermostat level, is perceived as a low temperature by our body, and in response, the hypothalamus will cause vasoconstriction and shivering. These episodes are called chills. Now, once we use the antibiotics, once the fever is subsided, these interleukins will go down and the prostaglandins will go down, and again the thermostat will come back to normal. And when that happens, our body temperature, which is still at the 101 degrees Fahrenheit, it is now perceived as higher temperatures, and hypothalamus reacts to it by causing vasodilation and sweating. This episode is called crisis or flush, and it is the end stage of. Now there is